Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I'm the Executive Director of National Speaking of Women's Health. And thanks for joining me back in the Sunflower House. It's not my usual background because I am in my office. I just got done seeing patients. And we have a very special guest today who's also a physician who is very busy, and she's probably in her office. And her name is Dr. Amy Morrison Zack. And she is a family medicine physician in the Department of Family Medicine at Cleveland Clinic. She practices at South Point Medical Center and Fairview Hospital. So she's on both sides of the town. And she's vice chair of education for Cleveland Clinic Community Care. And she's an assistant professor at Case Western. And she earned her medical degree from George Washington University. And then she completed a family medicine residency training at University Hospitals of Cleveland, and we were just talking about how they're closing that down at the main campus. But there's lots of ways for people to train in family medicine in Northeast Ohio and beyond. And Dr. Zack has a particular interest in education, and that's what we're going to talk about. And so this podcast is a little bit more geared towards physicians and nurses and pharmacists and advanced practice people. However, you women in the audience listening, if you're going to be seeing your physicians or your healthcare clinicians in the next couple of weeks, you might want to talk about what we're going to talk about today. And so, welcome, Dr. Zack.
Thank you so much for having me today. I'm so excited to be here with you.
And so, tell us what we're going to chat about, why I wanted to interview you, what the big event is that you're in charge of.
Well, we are planning a brand new conference format at the Cleveland Clinic. We are taking two very important, longstanding, and successful conferences, our Primary Care Updates Conference and our annual Women's Health for Primary Care Conference, and merging the two into one really incredible event. And we're really excited to present that to everybody, and I'm happy to be here to talk about it today.
Well, that is just terrific. So this is a course to educate clinicians about primary care, women's health, and behavioral health. And I was delighted when I got invited to speak, so I know I'm on the schedule to give a lecture about menopause and hormone therapy and all the new different alternatives. And so I think I submitted my PowerPoint presentations. So tell us about some of your speakers and like who the keynote speakers are and things that we should know about.
Sure. So we have a couple of really fantastic keynote speakers this year. One of whom is Dr. Martin Shapiro, who is a really distinguished researcher and professor of medicine. He is coming to us from Weill Cornell Medical College and used to be the division head at UCLA of internal medicine and public health. But most important right now, he is the author of a couple of really important books on healthcare. I think we're all familiar with a lot of the problems in the structure of healthcare. Accessing care, making appointments, how do we navigate the system and pay for it? And he wrote a book recently called Getting Doctored, but has a new one out entitled The Present Illness, American Healthcare and Its Afflictions. And so he's going to give a really interesting talk about the value of primary care across the spectrum. And so that might include your women's health care, geriatrics care, family medicine, internal medicine, as really the foundation of our healthcare system and some of the barriers that are there in trying to access that healthcare.
Well, on our Speaking of Women's Health podcast, we've had podcasts on many of those topics. Should you see a physician? Do you need to see a nurse practitioner? We've had experts on Medicare and how to pick your secondary Medicare insurance, which I mean, I've been practicing for years, and I'm like, I can't believe I didn't realize that, because I treat a lot of people who need expensive biological drugs, and when you go for a Medicare Advantage program, well, then your copays for your drugs are going to be much higher. And I'm thinking, how did I not know that? And we have some upcoming podcast on how to prepare for your your visit. And every day in the office, I hear from my patients that they can't find a primary care doctor, their primary care doctor moved, their primary care doctor is so busy, or they wait several months and then they get in and see the APP. So it is really kind of a crisis. How are you dealing with that in with your leadership roles?
I think it's really tricky. One of the most important things we can do is educate our physicians, APPs, all of our providers in how to help assist patients through the process. I think to your point, you didn't really know that much about it and taking an advantage and Medicare Advantage or a different program. I think the more that we understand the process, the more that we can help our patients and also be advocates for them in this process. The other thing is being flexible. When someone hits a donut hole or changes insurance or doesn't have any, how do we navigate that with our patients and still provide them the care that they need? And I think that's really important.
Yes, I think that we need to be educated as healthcare clinicians, and then our patients do too. And I always tell my patients, be
Absolutely.
organized, get that appointment early. It's easier to cancel an appointment a month or a week in advance as opposed to trying to get that appointment, and come
Hmm.
organized with your records. I always like my patients to bring in their actual medication supplements, hard copies of important results. They think, oh, it's just on the computer. Well, there's lots of things on the computer, but it's not always, they don't always
Yeah.
talk to each other. And you trained at UH, and I know, gosh, they can sometimes see our records, but we at the Cleveland Clinic can't always see their records. And it's like,
It is. It's very tricky. I say the same thing, or, I spend a lot of time helping my patients learn how to download their apps to reach their medical records in real time. So my chart or otherwise, really having the access that you need as a
mhm.
patient so that you can help us help you. I think that can be very helpful as well.
I know. I always tell patients, get your smartphone out, and I have them link up to my Speaking of Women's Health, and I'm like, oh, do you have the MyChart app? And some of them have it, but
Hmm.
they don't even know where it is. Or, oh, here's the podcast app. You can listen to Speaking of Women's Health. Or, here's some health calculators. And so we are carrying these little pocket computers with us all around, and it's good
Yeah,
to have
it's a
patients.
powerful tool.
Yes, it certainly can be. So tell me why a busy physician or nurse practitioner or nurse or pharmacist maybe wants to come to this conference. Give us the dates in November and
Sure.
why someone needs to come to this course.
It's really going to allow anyone who attends to have some really important updates. It's really incumbent on each and every one of us to stay up to date in our knowledge, and focus on new guidelines and new studies. And it's going to provide all of that information around the most important changes in primary care and women's health. Really thinking about how do we practice in an evidence-based fashion, depending on what your specialty is or what your area is. There's something for everybody, and so I think that that's the primary thing folks will get out of it. But there's also a really important aspect of regaining that enthusiasm that we all start out with for learning
Yes.
and for practicing in the absolute best way that we can. And I think there's something wonderful about being together with your colleagues, learning together, and taking a moment just to, improve upon your own self and your own knowledge, just in that space for a day or two.
Yes, that is so excellent. In fact, right now we're taping this interview at the end of September of 2023, and this conference is in November. So we're going to be pushing it out
It
because we
is,
want to reach as many doctors and nurses and
yes.
people as we can. And um, you've been listening.
And it is, you asked me for the dates. I'm sorry, it's November 9th through 12th. And it is in the Cleveland area at one of our Cleveland Clinic facilities.
So you have been listening to the Speaking of Women's Health podcast, and I'm your host, Dr. Thacker, and I'm in the middle of interviewing Dr. Amy Zack, and we're going to give all the details about how you can register for this course as a healthcare clinician to get CME credit to get the networking, to get that invigorating feeling. In fact, right now, I have my fellows in specialized women's health at the National Menopause meeting, which I didn't go to because I had some patients in my custom fit physical program, which there'll be other podcasts about that with my nurse. So they were booked and I wasn't going to move those patients. And I was booked to talk to you. So I'm like, okay, I'm not going to go to the national meeting. I'm going to give
Thank
them
you.
the opportunity. But I'm thinking, oh, they're sending me pictures. They're networking. They have breaks. They're talking about what they're learning. They're presenting some research that I've done in our Center for Specialized Women's Health on trabecular bone scoring and osteoporosis, which maybe I'll get a chance to briefly touch on my presentation that I'll be giving on November 10th. But especially now, and especially for younger physicians who've kind of grown up or had some training in the pandemic, because there was no meetings, everything was Zoom, everything was remote. So if you're listening to this, or if you're a patient who's about to see your healthcare clinician, tell them about this conference. And so tell us how people can sign up to get the CME.
Sure. So everything's online, of course. You can visit the Cleveland Clinic meded.com website,
Cleveland
and you'll see a link there,
Cleveland
Cleveland
Clinic
Clinic
meded.com.
meded.com.
Okay.
And you will see there a link for live courses, and you can find our course that is entitled Primary Care Plus. And you can register, you can see the agenda, all of the information about the course, all of our speakers, including the incredible Dr. Thacker. And also our accreditations are listed there. So we are accredited for continuing education, not only for our physicians, but also for our pharmacists and our nursing partners. And many of our nursing colleagues have found this conference to be a really wonderful event for themselves as well.
Oh, that's great. It's so great to have the whole team together. And we will include that link in the show notes of today's show. Lee Klecker, who's our executive producer of the podcast and our community social manager, she will get that out, and she's going to be doing some guest podcasting as well on our Speaking of Women's Health channel. I wanted to ask you one last question, Dr. Zack. I was very interested in the hands-on workshops. Can you tell us a little bit about that?
I would be happy to. They are really one of our most exciting parts of our conference. We offer 3 opportunities for hands-on workshop. The first is around glucose monitoring. I think we're all aware of the continuous glucose monitor revolution in care. And I think whether you are a healthcare provider or not, that's something you see folks all over with those little white dots on their arms
I
so
see
they
them.
can scan it and check their sugar without that nasty finger prick, bleeding and pain. It has changed everything in managing diabetes and prediabetes. So we're going to allow everyone who is at the conference to have the opportunity to try these devices, learn how to use them, how to place them, how to wear them.
Cool.
They can actually put them on. It's a really great opportunity for us to really experience it from the patient side of things, but also gain that knowledge to help get these for our patients in patient care as well. And, for our nurses and pharmacists, they are a really key part of our team in providing these for patient care. So that's one. And another really exciting workshop is around contraception for women. As part of a continual effort in education at the Cleveland Clinic and primary care, we work to create access for women to long-acting reversible contraception. That would be our IUDs as well as our Nexplanon devices. We are offering a course on IUD insertion, teaching folks how to place those IUDs safely and effectively, and at that time as well, endometrial biopsy skills. So these are wonderful skills for a primary care provider, outpatient women's health provider to have. So we're excited for that. And finally, we're offering a workshop on musculoskeletal injections.
Oh.
So how can your doctor help you with that knee pain, shoulder pain,
everywhere,
trigger points, all of those things, how to help with some of those very, very common concerns.
On the long-acting contraceptives, I recently gave a lecture with a very experienced OBGYN for free CME, and we actually have a landing page for physicians on our speakingofwomenshealth.com site that they can go on and they can watch the lectures and get credit. Also, we link to a website called menopauselearning.com where there's lots of free CME and booked and taped lectures. And this podcast that I'm doing on speakingofwomenshealth.com, it's broken up into
Yeah,
three. I podcasted my book, The Cleveland Clinic Guide to Menopause, which I'll probably mention at the conference for people who want more menopause education. And
absolutely.
then just this general podcast of all different topics that people are interested in. And I have a channel where I've written grants and we have some CME podcast on the topic of new candy neuron inhibitors that treat hot flashes non-hormonally. And so clinicians
Right.
can listen and get just answer a couple questions and get free CME credit. Now, with your great conference coming up November 9th through the 12th,
Ninth through the
9th through
12th.
the 12th, and
Yes.
I think I'm speaking on the 10th. Um, I have specialized women's health fellows that I trained for 2 years to become women's health specialist. And I always send them usually to all the great conferences that we have here and some outside the system. But one of them, I think, had a predetermined trip out of the country, so she can't be there. Only one will be there. So, is there any way for someone who is booked or can't make it to the conference that later is there a fee or a log on or a way that they can get some of the lectures? Like, I can't be at all the lectures myself, but what you said sounds
Yeah.
wonderful and the agenda looks great. And what if I want to later on my own time listen to something or get that educational content and make it enduring?
So if you do register for the conference, you will have access to all of the PowerPoint talks and any associated reference materials. So perhaps we have tip sheets or other take-home points or instruction guides. All of that information will be available on the course landing site after the course takes place. We don't record all of the sessions. So there won't be recordings available. That actually is as a result of sort of the resources and cost associated with that.
Okay.
But you certainly would have access to a lot of the
Uh-huh.
materials. And our faculty for the conference are always available. They provide their email addresses. You can reach out and contact with any questions following the conference in the time afterward.
Mm-hmm. Great. Well, I know that whenever I send my fellows to conferences, they are always instructed that they must take excellent notes and send them back to me because I
Yes.
evaluate them and then I send them out to my group because we really are all responsible for educating each other. So I'll make sure that that gets shared. So I just want to thank you so much, Dr. Zack, for
Yeah.
joining us in the Sunflower House on the Speaking of Women's Health podcast. And people can go to Cleveland Clinic MedEd dot
Com.
com and they can
Mhm.
register for the course. The course is still open. There's still spaces. And
Absolutely.
so,
We would love to have
so
you.
any women out there listening, let your doctor and nurses know about this at the Cleveland Clinic. And where's the location that it's going to be? Is it on the east side?
It is. It's actually at the Cleveland Clinic Administrative Campus, which is in
Oh, that's
Beechwood,
great.
just east of the city of Cleveland. Free parking, really easy in and out. It's a really nice venue. Meals will all be included during the days, and we look forward to inviting anybody who would like to join us for that camaraderie and learning together.
And if any of the speakers are interested in me interviewing them to talk about their key points and highlights to get that information out to women, I would be happy to do that. Um,
Oh,
and so would
wonderful.
Lee, our executive producer. In fact, she has such a nice, calm manner about her, and her voice is so pleasant, just like yours. In fact, sometimes I think this isn't Lee, this is Dr. Zach, but it's very,
Well, we appreciate that offer. And I actually think there are some topics that would be really great to have on the podcast and would have a lot of interest to everybody who tunes in.
yes, like that self-monitoring of the blood sugar. I mean, I don't directly
Hmm.
treat diabetes, but certainly a lot of people have that problem and getting the latest information out on our website, speakingofwomenshealth.com, anyone with an
Yeah.
internet connection, you can click that subscribe button to get our free newsletter and monthly health tip. We have recipes, we have free treatment guidebooks, and of course, anywhere you listen to podcast, um, on your podcast app, or you can do it through the computer on the speakingofwomenshealth.com site. So we really encourage all of you out there who are listening to either subscribe or follow and give us a 5-star rating if you would. And if you're so inclined and want to make a donation to our nonprofit, speakingofwomenshealth.com, you can do that too. And I think the month of November, which is Thanksgiving, I will definitely be doing a gratitude podcast. So to all of our listeners, thanks so much for tuning in. Thank you so much, Dr. Amy Zack, and I hope
Thank you.
that we have many doctors and nurses and pharmacists sign up.